Assessment before, we sat down and decided what to do, and identified some things that just bug her, which are typical of most women, as we get out of 28, 29 years old. So the most common thing that we see is this frowning thing, right? We're all making this frowning face. And if you think about what part of the face is showing during COVID and mask time, it really is this upper third of the face. So we emote a lot of facial expressions, but this is a negative one. Frowning is something that we don't need to do, right? Frowning is just a negative energy right there in the middle of your third eye. So relaxing it not only gives a sense of well-being, but you don't look stressed out and worried. If you go ahead and raise your eyebrows. She's got some forehead lines, which we can soften. I'm not a fan of the frozen. Frozen is a telltale sign that something was done. So I like to have the little bit of movement. Our lifting ability of our forehead is important for things like mascara and keeping your eyes wide open, but they don't have to be so dynamic in that they leave their mark behind. Smile lines is a choice. Some people hate them. Other people have young children, or they're therapists, or they're in some sort of profession where, again, expressing a joyful face is necessary for their job. So in those cases, I just like to lift the eyebrow a little bit of a brow lift in the corner, but leave, the rest, if that's okay with you. Because the overdone eyes can lead to a flattened smile and a little inauthenticity of the way your cheeks elevate. The other thing we're going to do is, if you would kiss me, she shows some vertical lines, which everybody gets through the aging process. Nothing you did. It's not smoking. It's not that water bottle. It's not that straw. It's not that other thing you might be sucking on. It is just part of, I can't not do me. Okay. So a couple of units in her upper lip will not only relax that, but give something that people come very specifically for, which is the lip flip. So her lip is truly in her mouth, but as we age, it inverts into the mouth. So relaxing this muscle will just give a little bit of a lip show. We call that the lip flip. She's also starting to show her, this will happen to everybody, I'm not picking on her. If you push your lower lip out like you're pouting, you can see that we're engaging a lot of this chin muscle. This is one of those muscles that have a very particular behavior as we age. It starts to come off our mandible, and not only does this coming to a center, sort of balls up a little bit. I don't know if you can see. And it also starts to create this crease here. And we have a very nice name for this called the witch chin. Okay. So this is an easy treatment. We're going to treat all these areas. It's done with a really fine needle. The conversation takes longer than actually doing the procedure. So we're going to get started. So there's three muscles that we're treating. This big guy in the middle that is responsible for up and down. And this guy on the side that has two bits to it. Okay, so we're going to start right there in the middle. Quick and painless. Going to isolate this next muscle. You can almost see how it's split, and I'm going to go to the other part of it. Again, we do the same thing. And there's different depths in which the needle goes. So some people may say they didn't get a good result. It could be the injection technique. Raise your eyebrows and relax. A lot of people will tell me that they can hear it crackling or making noises. You're heading your speaker, so it's going to resonate inside your house. I don't hear it. You guys just hear it. Again, I just like to do a softening of the eyes, but this is going to be elevated. If you want a brow lift, the brow lift comes from the eye muscle, right? So you don't get a brow lift from here because this is what that does. But I can get an elevation out of the corner. So a little poke right in the eyebrow tail. Smile for me. Just a softening of the main dude here. And brow lift. Smile for me. I feel generous and kind today, so I'm going to give her an ice pack for her upper lip. Because there's a lot of nerve endings in there, so it can be a little uncomfortable. But in the meantime, we're going to do your chin. Put your lower lip out. I'm so pouty.
All right, Bunny's right there.
Everything okay so far?
Mm-hmm.
Having a good time?
Mm-hmm.
With all these people. I would trust an ice pack to be clean. Okay, kiss me and relax. Kiss me and relax. Last one. Done. No bruising, no swelling, no nothing. There we go. Give a big applause for her. Yay!